Hi, it's Sonia. So now I want to go a little bit more in depth into the pelvis, spine, into leg relationships. So our spine comes down and then it goes to our sacrum and then it goes down to our tailbone. So that really should be your spine upright. And spine upright, you should have a nice, your natural arch in it. We don't necessarily want to correct anyone's unnecessary arches, but sometimes they are necessary because nerves are in there. So we have our bone structure, our nerves go in there, and then when we tend to get too strong with our muscles, if there are moving muscles, it tends to be at the expense of stability. So we have our pelvis and our sacrum. Our sacrum's kind of an upside down triangle, and it connects to the whole spine. So if we were to have that sacrum be tilted a little bit, then that's going to affect the relationship of when it meets up to the pelvis right next to it. And then if your pelvis happens to be uneven, where one's tilted back or one's tilted forward, then the nerves there can be a little bit more under attack. So the muscle that's called the piriformis attaches the sacrum, and then it attaches to the thigh bone. So what it does is, if the pelvis is fixed, meaning the pelvis is what's not going to move, it is one of the muscles that rotates the legs to turn out. If the legs are what's fixed, then what it can do is tilt the pelvis forward and back. So if you've ever gotten sciatic-like pain before and then you've used a tennis ball or a lacrosse ball in there, what you're doing is trying to find the nerve, and then in getting the fascia to release and the nerve to relax a little bit, then comes the reaction that's happening that's causing pain. And that's great, but I always like to look at like what's causing you pain. What muscle pattern are you causing in order to make the muscle rub more on the nerve, making the nerve kind of engage on a little bit more, and that's not a good feeling. So a lot of bridges, why bridges are given as homework is because in this tilted back position, which is probably the most common reason of people having back pain, it starts to then actually inhibit the glutes. So your butt really isn't even working functionally. It's just on. And it's in a shortened position if it's on. So if you go then to do bridges, you almost have to teach yourself how to turn your muscles off to turn them on, to have that on-off reaction versus them just chronically being on. I can understand in some ways why this kind of posture happens is because the glutes, which is a big muscle that's a stabilizer with a higher endurance rate, it thinks its job is like, it's a hero muscle and it's just going to be on, because then we also might go strength training or mountain hiking or whatever we do to kind of get the muscle on. And so what it does is try to tuck the sacrum in order to stabilize a little bit more, but actually we want to get out of the glute max a little bit more, into the side glutes a little bit more, to then have a little bit different balance of the pelvis. All right, and I'll send another video out going on a little bit more in depth onto this. Thanks.